Good afternoon, everyone. It's Dr. Tom Workup again from the Block Island Medical Center. Today is Friday, December 17th. A brief update on the state's coronavirus situation, our situation here on the island, and then some information about monoclonal antibodies. The state continues to see a rise in its cases per 100,000. We're now at 712, which is higher than it was a few days ago. The island seems to be holding very steady. We're up to 14 known cases. We had our 12 cases the other day. We're up to 14 known cases as of this recording. I have to say I appreciate all of the efforts that the school health team has done. They have screened many kids, adolescents, staff members, and they've done a wonderful job. The fire and rescue team has done an amazing job. Yesterday, they screened more than 130 patients. They did rapids as well as PCRs. We only had one positive out of the rapids, but that was an individual that we knew to be positive from a home test. So that's not a net new. I really appreciate all their efforts. They've done a wonderful job keeping our island community safe. I've been asked to reiterate the spirit behind quarantine. If you are known positive, then quarantining is only effective if you don't venture out into the community to run errands or to go to the grocery store. Please recruit family or friends to assist in that particular process. Remember that if you're fully vaccinated and you have an exposure to somebody that has coronavirus that's positive, you do not need to quarantine. But you do need to quarantine if you are vaccinated and have symptoms, you're partially vaccinated and had an exposure, or unvaccinated and had an exposure. That quarantine is for 10 days. On day 11, you can re-enter your life. Do not get retested. Your test will likely be positive, but you will not be infectious to community members and family and friends, etc. Thank you for doing your best to keep the entire island safe. The Block Island Medical Center will be closed for appointments over the last 2 weeks of December. The medical center continues to see greater numbers of patients each year. We appreciate and are honored by your trust to let us help you with your healthcare needs. Consistent with what we've done over the past 2 years during this time, the medical center will be available for emergency care, but we will not be available for routine, non-emergent elective appointments until we're back right after the new year. Let's talk about monoclonal antibodies. This is a way to rapidly jumpstart your immune system response to coronavirus. Scientists have identified antibodies from individuals that have developed rapid positive responses against COVID-19 and have synthesized it in large quantities for human distribution. There are currently 4 monoclonal antibody mixtures in the United States. 2 of them are predominantly for hospitals. The other 2 we will have. So we will have the bamlanivimab mixed with the etesevimab. That's administered together. They call it BAM-E. It's authorized under the Emergency Use Authorization Act for adults and pediatrics who are at high risk for progression to severe coronavirus disease, including hospitalizations and death. The next one is Regeneron, or casirivimab, and imdivimab, which are a combination. This is an investigational medication that is used for adults and adolescents 12 and older that weigh at least 40 kilograms or 88 pounds, who are at high risk for severe COVID-19, including hospitalizations and death. We have a very limited supply and an ability to infuse this medication. So we will predominantly use these as infusions. Regeneron can be done by subcutaneous, but the studies were really most effectively done as an infusion. These infusions have a very specific candidate criteria that are multifactorial based on age and health conditions. So we will be triaging every individual from the medical team that is eligible for this particular treatment. If we are not able to assist with the infusion, we are happy to make a referral to the regional administrators of Wesley Hospital or Thunder Mist Health Centers. We wish all viable candidates to take advantage of this option, but given our limitations in both supply and ability to infuse, we will have to make some referrals based on those medical criteria. Please understand that we're here to assist in getting you the proper referral for treatment if we cannot execute it ourselves here on property. Myself and everybody here at the medical center wants to wish everybody happy holidays, Merry Christmas, and a prosperous new year. We've gone through a lot this year. We'll continue to deal with this. We'll get out some new updates if anything happens that I feel the community needs to be aware about right away. But enjoy your time with your family. Enjoy this beautiful weather that we continue to get, and I'll talk with you soon.